Taking the bite registration. Before a TAP can be prescribed for a patient, the dentist must take a bite registration to send to the laboratory with a patient's stone models. Fit the George gauge in the patient's mouth with the handle at the midline. Have the patient move their teeth to an end-to-end position. The gauge will read 0. This is the neutral position. Have the patient protrude their jaw forward and measure. Then, have the patient retrude their jaw and measure. In this case, the patient ranges from +7 millimeters to -3 millimeters. You can take a bite registration with 2 materials, Thermacryl or Blue Mousse paste. Heat a small amount of Thermacryl pellets in a heat-resistant cup until it becomes clear and soft. Place the Thermacryl on the bite fork. Set the George gauge. In this case, it is 50% of the patient's maximum protrusion. Place it in the patient's mouth. Orient the bite fork along the midline with the handle parallel to the occlusal plane and directly forward. Remove the George gauge and cool the Thermacryl with Instacool or place it in a cup of cool water. Once cool, place it back in the patient's mouth and have the patient bite into the bite registration. Check for the fit of the bite and the location of the handle. Be sure it is parallel to the occlusal plane. Reheat the Thermacryl and repeat the process if necessary. The second bite registration technique is to use Blue Mousse registration paste. Use the George gauge at the same predetermined protrusion, 50% of maximum protrusion. Squeeze the mousse paste onto the bite fork. Place it in the patient's mouth and fill in the gaps between the teeth with the mousse paste. Remove the bite fork from the patient's mouth. And remove the fork from the George gauge. Place the bite registration back in the patient's mouth to check for fit. Start the process over if you did not achieve a quality bite.